Good evening, ladies and gentlemen, and it's a very warm welcome from Scotland. And welcome to our talk tonight. My name is Gary Johnston. I'm the chairman of the Scottish Centre and here to introduce our speaker tonight. Just before we start, you see a few slides coming up on screen as I talk. What we would, if you're a member of RMetS, that's really great. If you're not a member of the Royal Met Society, we would encourage you to join. There are huge benefits to becoming a member. But regardless of that, our talks are open to everyone, and we are glad that you are here tonight. This talk is on behalf of the Scottish Centre of the Royal Met Society. And before I introduce our speaker tonight, I would mention that if you have any questions during the talk, if you wouldn't mind putting them up on the message board, the whiteboard on the right of your screen, and we will ask Kaja to address these at the end of her talk. If you're referring to a particular slide, could you just note the slide so we can quickly flip back to that if you have a particular question on a slide. Right, at the end of the talk, as I said, we will ask any of the questions, and Kaja, I'm sure, will be happy to answer these. So, in going forward, our speaker tonight, I'm really pleased to introduce Kaja Milczewska, who is an environmental public health scientist at Public Health England, who is going to talk to us tonight on air pollution and health. So, Kaja, over to you.
Good evening, everyone. Thank you, Gary. So I think if I just press this, okay, I'll assume that that's my slides are on now on stage. So yes, thank you very much for inviting me to give a talk. So I currently work at the UK Health Security Agency, which was Public Health England prior to October 2021. So they've just gone through a changeover. And I was previously based at the University of Reading, where I did my PhD. And this talk is going to be kind of partitioned into two sections. In the first one, I'll talk a little bit about some of my PhD work, which is related to air quality and meteorology. And then in the second half of the talk, I'll talk a little bit about what the UK Health Security Agency does in terms of air pollution research and kind of communication to the public. So I'll go to the next slide now. Oh yes, so firstly, why are we talking about air quality in a Royal Met Soc presentation? Well, air quality and meteorology are related. Whenever there's a heat wave, for example, it is more likely for there to be an episode of high pollution. If you have a stable atmosphere and lots of sunlight, you might get higher concentrations of ozone and particulate matter, which means that getting the meteorology right in an air quality forecast, for example, is really important. It's becoming apparent that air quality is an important topic in itself. For example, the Public Health England Cleaner Air Programme is something that over 5 years is going to tackle some of the kind of key issues related to air quality. So it's been identified as a priority research area. And in the UK alone, it is estimated that between 28 to 36,000 deaths are related to air pollution per year, which is a big number. And unfortunately, one of those would be there was a little girl in recent years called Ella Deborah, who is the first person to have air pollution named on her death certificate. And it was a really tragic death, which was caused by, it was related to asthma attacks, which were related to pollution, high pollution in the area where she lived in London. So, as I said, during this talk, in the first part, I'll talk about my PhD work, which was mainly about relationships between errors in a meteorology forecast and the pollution forecast. And then in the second half of the talk, I'll talk a bit about the clean air strategy and kind of ongoing research and how it links to climate change and mitigation. So yeah, so the first part. So sorry about the busy slide. One of the first questions of my PhD was to kind of determine how important is the representation of boundary layer processes to forecasting surface pollutants. So I set out to try and understand the behavior of ozone and nitrogen dioxide through what I called a process-based evaluation, where I did some idealized trace simulations, which I'll talk about in a minute. Firstly, I just wanted to bring your attention to what the current operational air quality forecast looks like. It's issued by the Met Office, and it's on the DEFRA website as a kind of public-facing product. So the image on the left is the kind of domain of AQUM, which is Air Quality in a Unified Model from the Met Office, and the picture on the right is that public-facing forecast, which is kind of translated into a daily air quality index, and that's kind of partitioned into different colors. So, for example, green means that pollution concentrations are quite low throughout the country, but sometimes those colors can get into red or even purple, which means it's really high. And there's a certain public health advice associated with that, which I'll also talk about a little bit later. So a bit, I guess, some technical things about the forecast itself. It's, as I said, it's based on the unified model. It takes lateral boundary conditions from the global model and the CIFS, and it's based on 5 major pollutants. So that's ozone, nitrogen dioxide, sulfur dioxide, and particulate matter, both the fine and the coarse component. And importantly, the AQM produces its own meteorological fields. So that means that although it's based on the kind of global configuration of the unified model, but it and shares some of those parameterization schemes, but it produces its own meteorology as well. And the pollution forecast is verified against the automatic urban rural network sites around the country. So what I did was I first compared observed and modeled total oxidant concentrations from AQM at a number of urban background sites. I then performed some semi-idealized experiments with the NAME3 model, which is also a Met Office model. And then I diagnosed the meteorological related air quality forecast errors. So just a note about total oxidant, I've referred to this a couple of times now. So it's basically a combination of nitrogen dioxide and ozone. And it's the interconversion of those is dominated by 3 fast reactions, which are quite well known in the community. And those reactions represent a closed system, essentially. It's a photostationary state, which means that there is no net production of ozone or nitrogen oxide or nitrogen dioxide. Therefore, the mixing ratio of that combined oxidant remains unchanged. Now, this is a very kind of idealized scenario. That ratio may change as soon as there's exhaust emissions, VOCs. As soon as they kind of enter the equation, that balance is no longer in place. But considering that product enables me to sort of separate some of the chemistry associated with ozone and NO2 and purely concentrate on the kind of meteorological effects. So I did some analysis on the forecast and observations of this quantity. And I picked out a week in June here in 2017, which I thought was particularly interesting. So on the graph here, we've got forecast concentrations in red, the red solid line, and the observed concentrations are in the black dashed line, and those are averaged over all the sites. And then the shading is the interquartile range between all the sites. And the first half of this week, from the 19th to about the 21st, 22nd, was predominantly a high pressure kind of regime over the UK. So we normally associate that with lighter winds, and it was particularly sunny as well. And then in the second half of that week, it was there was a low pressure system hanging over the UK, which also correlates with stronger winds usually. So you can see that there's a larger kind of diurnal cycle of the total oxidant during the high pressure days than it is in the low pressure days. And that change in the synoptic regime is kind of captured by the model, which is good. And there's also a positive bias in the forecast when compared to the observations. So that means that the mean, or the red mean, is usually a bit higher than the observations. In terms of what the diurnal cycle looks like on a kind of day-to-day basis, the picture on the left, it's essentially the same lines again. The red is forecast and the black are the observations. And this is now averaged over a summer, so a whole summer period in 2017, again at the same 48 sites. And you can see that the forecast kind of overestimates that diurnal variability a little bit, which means that the cycle in the forecast is larger than the observations. And in the plot on the right, you can the plot on the right represents the rate of change of the concentrations. So you can see that in the before about 5 or 6 o'clock, it's negative, so the concentrations are decreasing, and then it starts to increase after about 6 o'clock. And there is a lag in the forecast when compared to the observations. So you can hopefully see that little arrow. The forecast starts to begin, so it begins to increase at about 6 o'clock, whereas the observations kind of increase between 4 and 5 o'clock. So I was really interested in why that happens, because what happens in the morning is, well, the sun rises, so you get more photochemical production of ozone. But of course, also the boundary layer grows because the sun rises, so convective growth begins as well. So I thought maybe it's something to do with that. Let's investigate. So my hypothesis was that this lag that we're seeing in the forecast when compared to the observations may be related to some of those boundary layer processes. So for example, entrainment. Entrainment is essentially the movement of air masses from the layer above the boundary layer. So I guess I call it the free troposphere, into the boundary layer as it sort of grows in the morning. So so here is where the name simulations come in. So NAME is a Lagrangian dispersion model, which is really great for sort of these kind of semi-idealized experiments. So in order to determine the role of meteorology, I've used UKV data, which is the current UK regional, UK numerical weather prediction model, and that's at an hourly resolution. And I also use the global configuration of the unified model, which is at 3-hourly configuration, and include linear interpolation in that. And I've also got simplified chemistry in here, which means that the only sort of sink of these traces, which are representing the total oxidant, is dry deposition to the surface, or also advection out of the domain. But there is no kind of chemical, there are no chemical transformations in this. And there are also no local sources of tracer. So I'm assuming that all emission and production occurs outside of that domain, which you can see in the red box on the right. Okay. So I hope this works. I've got a little animation of how I'm kind of looking at these traces. So these 3 circles, the 3 gray circles on the right, on the left, they represent singular traces. So let's say that they're advected in on this wind. Oh no, my animation doesn't work. Oh, never mind. Sorry about that. This animation is supposed to show that these traces sort of fly into this sort of box domain, as you call it, and one of them gets trapped inside the boundary layer below that line. One of them, and two of them are kind of remaining in that free troposphere, and then the boundary layer grows, and it sort of entrains one of the particles, one of the traces that was sort of sitting in the free troposphere, and in that way, I call them sort of tagged traces, which means I can kind of differentiate between where they came from and where they are. Okay, so more graphs with more lines. So I wanted to first evaluate that biennial cycle of these entrained traces to see how they compare against the real forecasts and the real observations of the total oxidant. So remember, these traces are just a representation. So on the left, we've got a diurnal cycle, again at, I think, the same sites, essentially. And the blue line are the traces that I've initiated with the global meteorology. And it's supposed to be red, but it's currently grey. The line above it, you can imagine it should be red, are the traces from the UKV. I'm really sorry. I transferred some of these slides from a previous talk, and the template is quite different. So I don't think all the settings transferred, but never mind. So the important thing is here is that the what should be the red line in that left graph is about 2 times higher in concentrations than that using the global meteorology. And then on the right-hand side, this is sort of a plot we've kind of already seen earlier in the presentation, but it's got an extra couple of lines. The bright blue and the bright red corresponding to the rate of change of tracer from those 2 simulations, from the global meteorology and the UKV meteorology. And what's quite interesting is that the global, the UMG, the blue line, is quite similar to the AQM forecast in the sort of dark red. And that also has that sort of lag in the morning increase, whereas the tracer simulations using the UKV meteorology are quite different, and they start to increase a lot sooner in the day. And because the only thing between those simulations, the only difference is the meteorology, it kind of hints at a possibility that that lag is related to just meteorological processes rather than chemistry, because there is none, which is interesting. I'm conscious of the time, so I might not talk much about boundary layer depth, but essentially it was important for me to check this out as well, because the boundary layer depth, you can see that in the model, it starts to increase in the UKV faster than sooner than it does in the global simulations. Yes, so it starts to increase about 4 or 5 in the morning, whereas in the global it's 6 or 7 in the morning. So obviously that's related to the lag in the morning growth, which is important. And I think this happens, I haven't got a picture of it, a graph of this, but I think this happens because the representation of the surface within the model. So for example, in the global configuration, the representation of land and sort of urban regions and rural regions is quite different. It's a bit more it's better represented in the UKV than it is in the global model, which means that there is a better representation of heat storage in urban areas. You may have heard of the term called urban heat island, for example, which has been shown to be better represented in that. And obviously, if there's more heat stored in that kind of configuration, that means that there's positive surface sensible heat flux, which means that the boundary layer begins to grow. So I just wanted to go back to that that plot that we've kind of seen earlier with these kind of different regimes within that week. So the black lines are the forecast and the observations, so solid and dashed respectively. And then on top of that, I've plotted the traces from my UKV simulations, and in the blue from the global simulations. And it's really interesting because in the high pressure kind of days, weaker winds, sunnier, that diurnal cycle is better represented in both tracer simulations than it is when the low pressure regime kind of comes in. So in that second half of the week, the traces from the global simulations do quite well. They look quite realistic when compared to the other two black lines, the actual forecast and the observations. Whereas the red line does something quite interesting. It's the concentrations are a lot higher than for the other simulation. So I kind of started wondering why is this happening, and we've kind of figured out that it's something to do with the entrainment parameterization scheme within NAME, where it's quite sensitive to vertical velocities across that boundary layer top. So in the case of the UKV, because it resolves much, a larger range of vertical velocities, I think that translates to more traces essentially being passing through that boundary, which is really interesting because it means that model developers have to be quite careful with how they represent that sort of vertical transport across that inversion. So just to summarize really quickly, that part one, I asked the question of how important is the representation of boundary layer processes to surface pollutant forecasts. And we found that the lag in the morning increase of the boundary layer depth in the AQM forecast, as well as the global tracer simulations, is related to that representation of heat storage in urban areas in particular. Remember, these were urban background sites. And this sort of lag in the boundary layer growth, it results in a delayed entrainment of free tropospheric air into the boundary layer during that morning period. And the semi-idealized tracer concentrations kind of capture the sort of the main aspects of that diurnal and synoptic variability, which is really good because it means that those simulations are quite reliable. And we can kind of conclude from that the lag in that morning increase of total oxidant may be due to the is due to the delayed entrainment of air from the free troposphere, which is rich in ozone, into the boundary layer in the morning. So it's just one of the questions I tackled in my PhD. Obviously, this wasn't the whole thing, but I've only got so much time, so I thought this was the most interesting part. And then in the second half of the talk, so sorry, just to say, if you have any questions about that first part, I don't know if people have been writing in the chat or anything, but please do ask questions, and I'll try to answer them at the end. And then there's that second part. I want to talk about the Cleaner Air Programme and how that links to climate change and mitigation and some of the kind of ongoing research within my team, but also kind of a bit broader as well. So the Cleaner Air Programme is a 5-year plan, which is concentrated around 3 themes in the UK HSA. So the first theme is to increase the evidence base. So doing and reviewing all the research on air quality, which includes sources of pollutions, pollution levels of exposure, and of course how that contributes to our health. The second theme is to improve awareness and understanding. So how do we perceive air pollution? What do we understand about it in terms of indoor and outdoor pollution as well? And to think about how we can improve the communication of advice on both indoor and outdoor air. So for example, with that forecast and kind of through other means as well. And then the third theme is about influencing and supporting stakeholders. So any decision makers and policymakers, the NHS and GPs and all sorts of people. Oh my goodness. So this slide had many animations, but they're not working at the moment. So I'm sorry about the clutter, but never mind. Increasing the evidence base, some of the kind of key areas within the research are exposure related to exposure to transport-related air pollution. Yeah, and air quality around schools. There's a lot of research around that at the moment. Solid fuel burning, so wood, burning wood in your home, for example. Dementia and cognitive decline, as well as air pollution and climate change. So I've put a few papers down here on the left. They're all quite recent from this year, and they're all really interesting. I wasn't involved with any of them myself, so I can't really tell you much about them. But if you have any questions, I can try my best to answer anyway, or point you to an inquiries email inbox as well. Air pollution and climate change is a really big topic at the moment, and people in the UKHSA have been quite heavily involved with producing reports and getting involved with big events. So, for example, there was a report by the Royal Society about the effects of climate change and net zero policies on air quality, and I've put a link to that there, and it's really quite interesting. And then the COP26. Of course, was a big event, and there were lots of sort of sub-events in that. But the Science Pavilion one with the public health in a warmer world was particularly interesting because that had members of my team and other teams as well, and they talked about obviously air pollution, climate change, but also things like vector-borne disease and how that might change. Through things like migrating populations of mosquitoes due to climate change. So it's all very interesting. And then the HSA produces a report on health effects of climate change. I think they're preparing to release that in 2023. The last one was 2012, so it's apparently now it's on its fourth iteration, and it addresses lots of different topics around air quality, and they're all related, really. But some of the kind of key areas that I've highlighted here are how ozone is affected by heat and wildfires, and of course wildfire smoke is going to release a lot of pollution. So, and wildfires are going to increase over the next 50, 100 years. So it's really important for us to know how the air quality might degrade because of that, and how that will affect our health as well. And then there's a lot of work on indoor environments as well. So things to do with building regulations and ventilation. You know, as we want to decrease the increase the energy efficiency of our buildings, we may want to insulate them more, but unfortunately that could lead to worse air quality if it's not adequately ventilated. So there's a lot of work being done on how to kind of tackle all those issues and prevent overheating in homes as well. And I don't really know what else to say about this apart from it's all related and it's all relevant. And I guess it's a bit kind of a sidestep from meteorology, but it's all very interesting in my opinion. The other thing is that there's these health protection research units which do there's quite a few of them. I think there's about 14 or 15, but I've just mentioned a couple here because they all deal with different environmental research, not all of it on air pollution, but these two in particular. So, for example, the Environmental Change and Health at the London School of Hygiene, they tackle things like how do we adapt our housing to withstand climate change, and how to how to make those living conditions better. How might wildfires how will they affect our health as well? Heat waves and droughts. A lot of research about food systems and agriculture, as well as I mentioned, vector-borne disease and other infections and many other topics. And then the other HPRU that we're quite involved with is the environmental exposures and health at the University of Leicester, which is less, again, less air pollution kind of focused, but they do work on indoor air. So for example, carbon monoxide and volatile organic compounds, VOCs, which are released by cleaning products and cooking and all those kind of indoor human activities. There's work on bioaerosols, in particular fungi, and how they affect our health, spores, things like that. Metals and dusts, so heavy metals like arsenic, which may be found in soils, and investigating how water contamination will affect affects our health as well, and noise, which is maybe not something we think about a lot, but well, you might think that noise, loud noises may affect your mental health, or I guess just degrade your quality of life. But there is emerging evidence that noise can also affect cardiovascular health, which is really interesting. I'm not really sure about the science myself, but I can point you to some people if you do want to know more information about that. The second theme of that clean air strategy is, clean air program, is to improve awareness and understanding. So I'm just going to come back to this, that pollution forecast that we saw at the beginning of the presentation. And next to it, you can see some text about the levels of exposure. So we're going from medium to very high in different colors. And there's currently a lot of talk about how do we, well, does the advice provided to children with asthma, does it need to change? Does it need, excuse me, does it need clarifying? How is this advice communicated? So we've got this, we've got the forecast on the DEFRA website, but is it shown anywhere else? Should it be on the weather app or somewhere that's a bit more accessible? And also testing new messages and how could the associated effects on behavior change, because if you know you've got underlying conditions, so respiratory or asthma or cardiovascular, you may want to avoid excessive or strenuous activity outside when there's a high pollution episode. So yeah, there's a lot of talk about how do we, how is that communicated to the public? So for example, before I started my PhD, I didn't know that this existed. I don't know if many people do, so hopefully that's getting out into the open a bit more now. The other thing about improving awareness and understanding is sharing knowledge. So, for example, UKHSA provide free e-learning modules for GPs and nurses, so I guess healthcare professionals, because they need to be aware of the negative impacts of air pollution on health and obviously pass that on to the patients. And there's also things like the Knowledge Hub, which local authorities, members of the local authority can be part of, and there's kind of conversations about different things within that. And there's also annual meetings, which, so for example, the first one, which is aimed at academics, is more about the kind of research to do with indoor and outdoor air pollution. And then the other one is about talking to stakeholders. So again, local authorities and government bodies, people like DEFRA, about some of these things and how can they be implemented into the world and provide positive change. So we've also got the Committee on Medical Effects of Air Pollution, COMEP, who was gathering lots of data about PM2.5 and long and short-term concentrations and how they affect health and how we can reduce the exposure of the whole population. And also looked at other pollutants as well. So yeah, there's lots of kind of communicating to policymakers in order to make sure that the population is not exposed to detrimental concentration levels to pollutants. And they've also released some new NHS asthma guidance, and there's a trial of an air quality health indicator tool, which may be, I don't know if it's already available to the public, but I think it may be quite soon. And you can sort of look at things like emergency hospital admissions for cardiovascular or respiratory disease, which is of course related to air pollution as well, which is which is really quite interesting. Okay, so that was a whistle-stop tour of everything that I've kind of some of the things that I've done and some of the things that are kind of happening in the UK. To say I've probably only skimmed the surface of everything that happens. There's really a lot of work going on behind the scenes as well. So I guess to conclude my slightly jumbled up presentation, going back to the things I presented first, and the first couple of points, we know that there's ozone and NO2 and the total oxidant, it can be quite tricky to forecast as well, and it's important for public health. It's important for us to know the concentrations of that in the forecast, and it's important to get it right. So one of the ways that we could improve the sort of timing of the onset of growth of these concentrations is to improve that representation of entrainment in the air quality models. And following that, we can say that the representation of boundary layer processes is really important, especially when as many models kind of go through, there's a lot of updates kind of going on right now. So that's really quite important. And then I guess in a slightly more broader sense, air quality is a key research area. We will breathe. It's really important for us to breathe clean air and to be aware of some of the sources of pollution as well. So the PHE Cleaner Air Programme sort of aims to increase that evidence base and improve public understanding and to support stakeholders. And but by that I mean people who can implement some of those changes as well. So just a quick acknowledgement slides. There's a lot of people on there because, as I said, a lot of these things are not just my team, they're all the other sort of neighboring teams around me. So the climate change group and epidemiology group and toxicology and COMEEP. And of course, from my PhD work, it was a NERC-funded project with support from the Met Office as well, based at the University of Reading. So yeah, thank you. I've left my email there. So if I don't get to answer your question, you can email me afterwards. And there's also the kind of centrally managed air pollution inbox. So all queries get answered. If you have anything specific you want to ask about air pollution, you can contact them as well, and they'll definitely get back to you because we have a rota, and I'm one of those people who does that sometimes. So every query gets answered. So yeah, I think that's it. Thank you.
Great. Kaja. Very interesting talk. And you coped very well with some of your slides, obviously not working with the system that we're using here at RMetS. So apologies for that, but really well done. We have a few questions tonight, and they will appear on the screen. The first one is from David. And what he's asking is, he's saying, although NO2 and O3 are linked through air chemistry, they are very different pollutants, and the temporal change in NO2 plus NO3 are more readily interpreted if they are separated. Did you study the temporal development of these gases separately, and can you tell us why the model overestimates NO2 plus NO3, and which of these two gases is responsible for the overestimation?
Sorry, I have to it did study them separately, and ozone is the one that is responsible for the overestimation, I think. It was a while ago since I looked at them separately, but it was the ozone, I think, that was that had the overestimation. Yes, you're right. They are quite different in terms of the sort of temporal change, and the diurnal cycles look very different. I saw some anti-correlations between the mean diurnal cycles in the model, and I thought it would be quite good to just see how they look when they're sort of joined together in order to in order to sort of concentrate more on the meteorology rather than the chemistry, just because I'm not a chemist, I'll be honest, and there's not been that much. Well, there's been less work, I think, done in the community about the meteorological effects than chemistry effects. Of course, there's a lot of literature out there, but yeah, it was the meteorology I was more interested in. Don't know if that answers your questions. Sorry if that answers your question, but I'm happy to follow up if you do have more comments.
Okay, thank you, Kaja. Next question is from Jonathan, and he refers to slide 19. Is the overheating in homes the stagnation of air within a building?
Oh, I guess it could be. I think it's more about overheating in homes due to climate change. So I guess, for example, if you've ever lived on a flat on which is situated on a higher rise building without kind of air conditioning, you may notice that it gets a lot hotter in the summer than it would if you were living at a lower floor. So obviously, if there's not enough ventilation, then yes, you may get stagnant air, but also just the fact that it's warmer outside, translates to it being warmer inside as well. So even if you've just got natural ventilation, that may not necessarily help with the overheating inside, unless you have mechanical ventilation, for example. So there's a lot of research into that at the moment. Yeah.
Okay, thank you. One question comes from within the RMetS organization. Did you look at investigating the diurnal cycle of emissions from different sources, and if this was the reason for the errors in your model?
That's a good question. No, I haven't. No, I didn't look at the different sources of emissions in particular. So, for example, in AQM, which is obviously the operational forecast model, a lot of those emissions are based on a emissions inventory. I think it's called the natural atmospheric emissions inventory, and it's kind of a gridded data set which kind of gets fed into the model, and then what the pollution concentrations are in the product in the end are kind of mainly determined by by equations within the model. So not really specific emission sources themselves, if that makes sense, because they don't really change over time within the model. I don't know if that answers your question. Sorry. Yeah.
Yeah. Okay, thanks, Kaja. One from Dimitra, sorry, all the way from Greece, and nice to see our visitors from abroad. We've got another question coming up from William in Canada, and I see somebody from Ghana as well. Dimitri is asking, he says, I was reading the latest air pollution compliance assessment summary from the Department of Environment, Food and Rural Affairs, and it said that the UK met all the target values for O3 in 2020, as it has done for many years, but the number of zones exceeding the long-term objectives for vegetation, bracket 16 zones, was relatively high compared with the previous years. It also said that the UK is fully compliant with other pollutants. I was wondering what your insight or what your view on this is.
That's a really interesting question. Thank you. I'll be honest, I'm not particularly confident talking about the different objectives and targets. I know that the air quality guidelines set by the World Health Organization have been recently updated to make those targets even lower for sort of negative health effects. I think the best way to answer that question would be if you wanted to submit it to the air.pollution at phe.gov.uk inbox. I think they'd be very happy to answer that kind of question, because they'll have a lot more kind of insider knowledge than I do. Sorry, I can't answer that at the moment, but if you email it in, they'll definitely pick it up and give you a good answer.
Okay, thank you. A question from William from Canada.
Hi.
Did roadside emissions, if measured data were available, play a part in the diurnal NO2, given that there are peak in the AM and late PM due to rush hours?
I think in this case, right, I didn't consider roadside emissions because that variability can be, well, it is very dependent on what the traffic is out on any given day. So I only looked at urban background sites, which are kind of more representative of a larger area rather than just at the roadside. As you'd imagine, the pollution concentrations are quite heavily kind of concentrated in by the roadside. They are available, they do exist. I just didn't want they just weren't suitable for the question I was trying to answer. Although saying that there were AM and PM peaks in my data as well, just because there are still roads, even if you just kind of take a background site, some of that pollution will still be picked up by those, but not nearly as much as the kind of roadside sites. But yes.
Okay, thank you, Kaja. Just one question I have. Where was your research in terms of COVID, the pandemic? And did that factor in at all? And is there anything between non-COVID and COVID? Because obviously for a long time, people were housebound and there was not so much car pollutants, relating to the last question, car pollutants.
Yeah, definitely. So I think there's been quite a lot of research about, for example, levels of nitrogen dioxide and particulate matter over a shorter period in, for example, May, June, July, I think in 2020. And indeed, those concentrations did decrease. But it was only for a short period of time. They did start to increase quite soon after that sort of initial dip. In general, in the UK anyway, I'm not sure about other countries. Again, I've read some things here and there, but I'm not. It's not really my area of expertise as such. Yeah, but they did definitely decrease in the UK for the first sort of couple of months when there were no cars on the road, as you'd expect.
Yeah. Okay, I think that's all the questions we have. I'm not seeing any more coming up. So a lot of applause, a lot of people thanking you. And, on behalf of the Scottish Centre Committee, I would like to thank you. And I'm sure the wider public that are present tonight would also give you applause. We are working on because of the COVID, we're still working very much on the virtual meetings, and they do work very well, because tonight we have had people from far-flung areas, which is really good, and we intend to continue with this for a while yet. So again, on behalf of the committee and everyone on tonight, Kaja, I would like to thank you for your presentation and the time you've taken to deliver this to us. Again, I apologise that your slides didn't seem to fit in with our system. We perhaps
It's
should
okay.
have had.
Have to improvise.
No, very well done, thanks. Just before we leave, I would like to again thank the members of the public for coming along. Our next talk for your diaries, it's on the 14th of January, and it's atmospheric processes and their impact on the 79th North Glacier, Northeast Greenland. So that should be an interesting talk. This talk tonight, like all our talks, is being recorded and will be available on YouTube, subject to Dr. Milczewska giving her permission. And just finally, I would like to thank very much the people behind the scenes who are assisting in running this. We're using software called Demio, and tonight is the first time that the Scottish Centre has run this completely independent of the RMetS head office. And so I would thank Vicky and Richard and Alan, who are working behind the scenes. So thank you again, and all I can do is wish you all a very Merry Christmas and a Happy New Year and a seasonal greeting to you all. And we hope to see you at their next talk on the 14th of January. Thank you. Right, as people drift out, Kaja, obviously, we normally thank you in person, but with COVID the way it is, that we just can't do that. We normally provide a dinner for our guests afterwards as a way of thank you.
Oh.
We we are running this independently for the first time, so we maybe should have possibly had an earlier run through with you to make sure your slides did work. So sorry about that, but it's
I was
sometimes
late uploading them as well, so I do apologize. It's partly my
no,
fault.
it sometimes happens, but it was really good to hear your talk and some really interesting things. The pollution is becoming more aware before to the public, or public are more becoming aware of it. Before we used to just put on the BBC News or the ITV News and used to wait for the weather forecast. But people being able to get this information online, air pollution is certainly becoming more of an interest to the general public. And it's good that people are recognizing that it's not just a chemistry based, it really is meteorology based as well. So, it is very good.
Yeah, certainly. I think some of the things I've definitely kind of found in my PhD, certainly while reading a lot of the literature, is that the sort of the atmospheric chemists and the meteorologists have tended to kind of work separately up until sort of maybe within the last couple of decades or so, certainly within kind of the modeling and forecasting world. So yeah, I think it's definitely becoming, I think the thing about my PhD, although I only covered one kind of research question, it felt very interdisciplinary because I kind of had to put on a meteorologist hat, but also a kind of a chemist hat, which I'm not a chemist, so I definitely learned a lot. And then, my background is physics, so a lot of that kind of ties in as well. And it's, definitely something that is not just one kind of discipline. It's very, it's so interdisciplinary. And I think hopefully maybe that came across in the second half of the talk. Maybe it was a bit jumbled. I apologize. It was my first time kind of talking about UKHSA work. I've only started in June, so I have not really talked about it publicly yet. So hopefully that was, I don't know, maybe more or less clear. But I guess the point is that there's many sort of crossover themes which have air pollution at the center. It's an exciting topic to be in, definitely.
Yeah, and I think even at a much lower level, you'll probably notice that a lot of amateur weather stations, it used to be just recording the basics, rain, wind, and then it became a bit more advanced in recording sunshine hours. But now all weather stations seem to have an add-on for registering pollution, recording and registering pollution as well. So it is becoming an everyday subject, which is really good. But,
I'm really glad to hear that as well, actually, just because, again, kind of anecdotal evidence of trying to sort of relate some of the meteorology at particular sites to air quality at particular sites. Well, it wasn't possible because they weren't co-located. So, if I wanted to sort of compare what meteorology does at one place, I had to kind of look at maybe a site that was 30 kilometers away in
Yeah.
terms of, air quality and pollution, which isn't necessarily representative of the area as well as it would have been if it was, at the same place. So yeah, really, it's having the same kind of measurements in one place is, well, sorry, different measurements in one place is a really good thing for data analysis, definitely.
Yeah.
So I was just going to pop in. So I made the question about, I couldn't put my own name on it because I was on the Meta Society account, but I asked the question on the background. But I think because I do a lot of air pollution stuff in SEPA, and I work with some people at PHE, but I think historically the weather stations were at airports for military purposes, and the air quality is all in the sort of urban areas, and so you don't tend to want them in the same place because you want the sort of meteorology in an area where it's flat and there's no trees, and that's where you get high air pollution.
Yeah.
Yes, definitely.
Yeah,
there is that as well, definitely.
Yeah. So, some of the big weather station manufacturers, Davis Instruments and Purple Air, they not only produce equipment for amateurs to put up, but they're very well calibrated, these instruments, and very well checked before they come out the factory. And you can access all these on websites. You can follow where they are put up. They're not always put up in sensitive places, but generally you can get access to this information. So it is really good. Yes.
Yeah. Open public data is definitely the best thing. Making it available for everyone, definitely. Yeah.
Yes, you're now totally ensconced into the public health England. That's I presume your first job, Kaja, since leaving university, is it?
Yes, it is actually, which is quite scary.
Yeah, how exciting! Yeah.
Yeah, it's also very interesting to be kind of not really in academia anymore, but still sort of keeping very much on top of the kind of research that happens. And there's a lot of research that happens within the organization, and as I said, kind of linked into other universities as well. And it's all very wonderfully cross collaborative, which is really great to see. Like no one's kind of doing research on their own kind of thing. You're always working with this university and that university and DEFRA and COMEP and other sorts of organizations, which is is really great. Yeah.
Well, good luck for the future, and
thank you.
keep up the good work. And again, thank you very much, Kaja, for your time tonight. We very much appreciate it. The whole of the Scottish Centre very much appreciate the effort that you put in and coming along to speak to us all tonight.
Thank you for inviting me. It's been a pleasure.
Yeah. Okay then. Well, goodbye just now, and a Merry Christmas, Happy New Year.
And you. Thank you. All right. Take care.
Okay.
Bye.
Bye just now. Bye. Bye.